with changes, with overload of the teeth, the symptoms might be failing or breaking teeth or restorations, tooth pain, loose teeth. And this is where I would imagine that among the acromegaly community, there may be some frustration with people like me, with dentists, because it's a kind of situation where you could, place a restoration or a filling, and a person could go away, and 6 months later it could break, or a year later it could break. And the real reason for that would be, one reason for that would be the movement of the teeth. If the teeth are moving a little bit, or the jaw's growing, then the way those teeth are being loaded, it's going to change over time. So that's something you can almost, I don't know if expect to be the word, but it could possibly happen in acromegaly. You could have some dental restorations that may be a little more prone to failure over time. But just, be an ally with your dentist, and if your dentist knows, and we're going to try to get the word out, then that would be one of the things that we would have to kind of be aware of, that sometimes dental work may need tweaking over time. Overloaded teeth also can lead to loose teeth. With overloaded teeth, if that is deemed to be a concern, then bite plane would help with that too, because it would distribute forces over your teeth. And bite adjustment, this shows where this person on that right side has a contacting surface that's it's quite early on, but that's taking way too much load. The indirect effects of acromegaly, this could go on and on. There are so many, you think about it in different ways. A lot of the things that happen hand in hand with acromegaly have oral health implications as well. The big one being, big two being heart disease and diabetes. Are there any diabetics in the room? Any people with diabetes and acromegaly? With diabetes, the big concern would be the inflammation and the delayed healing and being prone to infections. So, if you have spaces between your teeth and you got gum disease and you're diabetic too, those are things that are going to really conspire against you. So really, kind of join with your dentist and really, it's really important to keep teeth clean. Heart disease, it used to be, and this is just changing right now. There was, up until almost this year, there was a lot of literature out there that suggested that there is a strong correlation with the bacteria that cause gum disease and heart disease. But very, very recent literature is suggesting that link may not be as clear as we thought it was. But for now, we're still kind of going with it. We still believe that with heart disease, and if you have gum disease, and your risk of heart disease is a bit greater. But that's something that we may find over time, may not be as clear cut as we thought it was. So with diabetes, as I say, more prone to infections. Gum disease is much, much more prevalent in diabetics, and healing is delayed. When we manage diabetics from a dental perspective, we kind of stabilize general restorative and other dental issues, get them really brushing and flossing well, and again with the cleanings, seeing the dental hygienist. As I say, with the heart disease, that's it's not quite as clear as we thought it may be. One aspect of heart disease, though, that is still a concern is valvular disease. Certain valvular defects, we still believe that the bacteria that cause gum disease have an affinity for heart valves. So with certain dental procedures and certain valvular conditions, we give people antibiotics before dental work. And that's if you have any problems with the valves of your heart, as can be, from what I've read in the literature, a concern with acromegaly, then certainly discuss that with your dentist if you discover that that's the case. Hypertension and arrhythmias, that's the heartbeat, irregularities that way. There can be dental implications, especially with the drugs we use for local anesthetic. There can be interactions with the drugs that we use and medications used for both of those. Certain arrhythmias, people are anticoagulated. They may be on Coumadin or warfarin. That certainly has tremendous dental implications as far as bleeding goes, and also maybe healing too. So those are things that would be a tremendous concern for you when you get from on the dental front. With acromegaly drugs, both the somatostatin analogs and the dopamine agonists have vomiting and dry mouth as side effects. Have you found that? Any in the room, have you found, some of this, that's been an issue? I get my information just from the book, so I don't really know, how many have experienced that. But both dry mouth and vomiting can certainly have tremendous oral health implications. Dry mouth, it's going to increase the likelihood of tooth decay. You're already prone to tooth decay because of the spaces, and the other things. Things are conspiring against you. So you got the greater likelihood of tooth decay and the greater likelihood of gum disease. And it can be pretty uncomfortable, too. Management of dry mouth, gum, sugarless gum. But if you got TMJ, you don't want to do that. So, that's something that we put in there, but only if it's comfortable to do so. Water intake, low salt diet, decreased caffeine, alcohol-free rinses. Although it's funny, one of the things that I did see when I was looking at dry mouth symptoms, or treatments rather, I saw that the one reference I found suggested that gin and tonic was a good treatment for dry mouth. So I was going to do some research myself on that one and see if that was the case. Or you might just forget about your dry mouth. I don't know. But I like that one the best. And I'm not big on product endorsements, but there's one, and really it's the only line of products out there for dry mouth that really seems to work, is Biotine. There's got a whole range of products, a mouthwash, a toothpaste, a gel that you can use, can be very, very helpful. Vomiting, if that's been an issue, this one, it's a very low pH, a very acidic situation, and it's going to really weaken your enamel. Again, increase the likelihood of tooth decay and gum disease. If you find yourself throwing up with the medication, then one of the main things is to not brush right away. It's almost a reflex that you'd want to, but don't, because if you do that, you're going to drive the acidity further into the enamel and just going to brush away the enamel. So the recommendations for people who have frequent vomiting are to wait at least an hour before you brush, but do rinse. Do a really good thorough rinse and wait for at least an hour to brush your teeth. In medical management, there are medications that can be used to help with vomiting. Dry mouth, there are a ton of drugs. Almost every drug out there, you'll see one of the side effects being dry mouth. But there are over 400 drugs that can cause dry mouth, and among them, some of them that cause acromegaly, or that treat acromegaly. Other indirect effects, radiation. Has anybody had radiation as part of treatment for acromegaly? That's, I think radiation, as far as it affects the salivary glands, it's getting better and better, and the ability to focus beams is getting better and better over time. The salivary glands, if they encounter radiation, their ability to produce saliva or spit is going to decrease, and it's getting better over time. But if you've had radiation, one of the things you may find, if there's been salivary gland tissue in the path of the beam, then you may find that you have a dry mouth. There's some literature out there that suggests that there can be kind of a compensating effect from other saliva-producing glands over time, so you can get it back sometimes. But that might be one of the things that you may find after radiation. Those who have had radiation, did you find your salivary flow, your quantity of spit went down? Yeah. So that's. I've seen that for others who have had radiation. But certainly, it's just one of those things. If radiation is recommended, you've got to do it. But you may find that there's some salivary flow management that would have to take place. One of the things with acromegaly that's out there is depression. It's one of the common findings with acromegaly, and that may have an impact on oral hygiene too. If you got the blues and if you're clinically depressed, then I mean, you're not going to want to brush your teeth. You're not going to take the care to I mean, that's something that always falls by the wayside, and very understandably. But you rely on those around you to help you with that, if that were to be the case. Some antidepressants, some medications for depression cause clenching or grinding teeth. So, I mean, again, everything's being kind of interrelated. If you've got TMJ issues and you're taking medications that cause clenching or grinding, or dry mouth, some of the antidepressants also cause dry mouth. So they can be part of the mix as well.